Hello everybody, Dr. Goforth here at Cornerstone Physical Therapy at our Woodfin location. Today I'm going to be talking briefly to you about rectal pain. So this is a problem that I see quite a few of my patients for, and if it's something that you or someone you know has experienced, it's not a really fun one to have to deal with. So I'm going to be going over a few times or associated with different activities that you might notice rectal pain. So one, as you may have assumed, is during having a bowel movement. So not to get too much in detail, because I'm going to go in the next video of common causes of rectal pain, but there are muscles around the rectum and the anus. So if they're tight and you're trying to let that bowel movement pass through, it's like an uncomfortable stretch to those muscles, and it will hurt a lot of times if those muscles are significantly tight. Now, it may feel kind of like a burning sensation. It may feel kind of pinchy. It may feel sharp. So sometimes it's hard to know, is it a pelvic floor problem where you would come see someone like myself, or do I have a hemorrhoid? Maybe it's a little bit of both. Often people will have both. So it's a great idea to get checked out first by a colorectal specialist, have them see, what's going on from their specialty. And if you have a hemorrhoid, then you can be aware. And if not, or even if you do, they may say, hey, I don't think this should be causing you this much pain. Or, hey, you also have some issues with your pelvic floor. We notice it's really tight. Go see a pelvic floor therapist. So that's one time that you can probably understand would be reasonable to have rectal pain, is if you have a problem in the muscles around there during a bowel movement. Now, some people will have prolonged discomfort after having a bowel movement, or they won't really have much discomfort during the bowel movement, but then after it almost feels kind of like a spasm of those muscles down there, and it'll hurt. And sometimes it'll last up to several hours after having a bowel movement. If you're noticing that, you probably have a pelvic floor issue, and it's probably too tight. And I would recommend going or coming to us and seeing one of us. So those are two common times: during a bowel movement, after. If you have a lot of pelvic floor tightness and are what we call upregulated, where you tend to just hold a lot of tension in your pelvic floor due to mental stress, you might experience kind of nonstop, maybe like a lower level, but at any given time during the day, you're uncomfortable, we could say at least, or maybe in a lot of pain around the rectum, in and around the rectum. So knowing if you have anxiety issues, or you just tend to be what you would say an uptight person, hold a lot of tension, maybe it's not just down below, maybe you're a jaw clencher, keep in mind that that's a common cause of rectal pain too. Make sure you're managing your stress as best as you can. And then lastly, a common time of day, or night I should say, that people will experience rectal pain is at night. You might be distracted during the day, you're on the go, you go to lay down, you're relaxing, and all of a sudden, oh my gosh, I feel like I have a rectal spasm. This is really uncomfortable. It's really sharp. What is going on? And it might make you nervous, which then makes you hold more tension in your pelvic floor, unfortunately, and then that makes the pain worse. So it's a really not a fun problem to have. So if you have that issue or know someone, please recommend them to come see someone like ourselves, or if you don't live in the area, go see a pelvic floor specialist, because it's something that oftentimes is at least in part due to pelvic floor muscle dysfunction, and that's what we specialize in. And we can help at least lessen, if not get rid of those symptoms. So have a great day and stay tuned for the next video, where I'm going to be going over common causes for rectal pain.